too many teeth. Elliot hated the dentist. The buzzing tools, the sterile lights, the cold metal instruments, they all made his skin crawl. But he couldn't ignore the sharp ache that had been growing in the back of his mouth for weeks. A dull throb turned into stabbing pain every time he swallowed. Eventually, even breathing hurt. So, he booked the earliest appointment he could and dragged himself to Dr. Halbert's dental clinic. The office was quiet, too quiet. The receptionist didn't look up when he entered. The waiting room was empty and the magazines were years out of date. Still, the pain in his jaw was unbearable. He couldn't leave now. He was led to the back room. It smelled faintly of bleach and something else, something coppery. Dr. Halbert, an aging man with sunken eyes, examined him silently for several minutes, shining a harsh light into Elliot's mouth. Then he froze. The dentist leaned in closer, squinting, then frowned. "You have more teeth coming in," he murmured. Elliot tried to ask what that meant, but the dentist silenced him with a raised hand. He reached for a longer dental mirror. "Far more than normal," he added. Elliot tensed. He'd always been told he had perfectly straight teeth. No wisdom teeth to pull, no cavities. He'd never had an issue before. But now, Dr. Halbert was muttering to himself as he angled the mirror down his throat. Then, the light flickered. Elliot's eyes darted to the overhead lamp. When the light steadied again, Dr. Halbert was pale. He slowly removed the mirror and stepped back. "Open wider," the dentist said. "I can't," Elliot mumbled. "That's as wide as—" Then he felt it. Something shifted inside his throat, something sharp. He gasped and gagged. The feeling was unmistakable. The pointed edge of a tooth had scraped the back of his tongue. Not something he swallowed, not a fragment, a tooth, growing inside. Elliot leapt from the chair, coughing violently. Blood splattered the white floor. He stumbled to the mirror and opened his mouth. His jaw looked normal until he tilted his head back. There, deep in his throat, lining the walls like pearl-white barnacles, were rows of tiny, sprouting teeth. They weren't supposed to be there. Dr. Halbert tried to sedate him. Elliot resisted, panicking, but the dentist's grip was stronger than it should have been. The needle pierced his arm. The world went dark. He awoke in the chair. His jaw was clamped open with metal spreaders. He couldn't move. He couldn't scream. Dr. Halbert stood over him, surgical mask stained red. Behind him, the assistant, if it was even the same receptionist, held a tray of plucked molars, not extracted, harvested. Elliot felt the scraping again, deeper now. He wasn't numb. He felt everything. As the dentist reached deeper into his throat with forceps, Elliot's stomach lurched. Something inside him was wiggling, not with pain, with intent. Dr. Halbert leaned down, voice calm and surgical. "Your mouth isn't where they end, it's where they begin." Later, the clinic was silent again. The receptionist returned to her desk, her teeth perfect, porcelain white. In the exam room, Elliot sat upright, mouth closed, eyes blank. But if you looked closely, you'd see the rows of small, twitching teeth beneath his skin, pressing against the inside of his cheeks, trying to get out.